So far, you've learned about the benefits of being physically active, but we have ignored the risks, and there are risks. There's a reason why official guidelines don't consider an intervention that includes walking as being fall prevention. That is simply because if someone is at a high risk of falling, doing more walking makes it more likely to have that fall. Effectively, that means that physical activity should focus on other things, such as strengthening the muscles or improving balance. And then, once those things have reduced the risk of a fall, one can think about increasing walking. The risks are often quite acute, such as the risk of a fall. Other risks are that exercise does increase the risk of death, as well as serious cardiovascular events, such as a heart attack. This is because exercise can increase your blood pressure. Other risks are bone fractures, muscle injuries or sprains and strains, and potentially it can also increase the risk of infections. These can all be a consequence of being physically active, but particularly so when doing exercise that tends to be of a higher intensity. Luckily, there are also acute benefits to being physically active. Physical activity releases happy feel-good hormones called endorphins, which have been proven to ease the symptoms of anxiety and depression. Physical activity often also allows us to interact with others and limiting the amount of time we spend left alone. Again, loneliness has been linked to symptoms of frailty and can lead to depression. Following exercise, it is also a good time to eat something, in particular something high in protein. But if we take all these things together, the acute weighing of the benefits versus the risks might result in the risks outweighing the benefits. Reducing the risks is one action that can be done to swing the result, and that is where selecting the appropriate form of physical activity matters, whether it is exercise or not. That way, it becomes more likely to shift the balance. But to prevent frailty, we should also look at the long-term effects, and it is there where we can see the benefits starting to outweigh the risks quite considerably. Most of the risks are acute, with not that many risks that develop long-term. But the benefits are additive. The longer you maintain an increase in physical activity, the greater the benefits are. Your blood pressure might increase during exercise, it will drop after exercise, and this will also become lower and healthier over time. Your muscles can become stronger and your balance become better, reducing the risk of a fall and increasing your walking speed. Your heart and the lungs start to function better, not only reducing the risk of a heart attack or a stroke, but also making you feel less out of breath, and that could help prevent exhaustion.